name is BASIRON, and today I will present a project on robotic system about knee braces for torn anterior cruciate ligament patients. Anterior cruciate ligament, or also known as ACL, runs from the femur to the tibia and is made up of thick connective tissue. Because it resists anterior tibial translation and rotational stresses, the ACL is an important component in the knee joint. We move to the cause of injuries that include ACL. An ACL sprain or tear is one of the most common knee ailments. Typically, injuries develop as a result of quick changes in direction of movement, fast halting, jumping and landing abnormally, while activity or sport activity. A direct strike to the lateral side of the knee or decelerating while running are also one of the possible causes. For anterior cruciate ligament ACL treatment, we also known as the rest therapy, which include rest, ice, compression of the affected knee, and elevation of the affected lower extremities is also used in the treatment. For the anterior cruciate ligament test, there are three tests that are used to test the anterior cruciate ligament. First is anterior drawer test. The anterior drawer test is conducted with the patient affected knee flexed to 90 degrees and their foot placed. With both hands, the clinician will hold the proximal tibia and pull it anteriorly. The test is positive if there is significant anterior mobility and instability. Patients may have increased ACL laxity that is not pathogenic, therefore comparing to the normal knee may be informative. In chronic injuries, the test has a sensitivity of 92% and a specificity of 91%, but not in acute injuries. Second is the pivot shift test. It is carried out when the patient is supine, beginning with the knee in extension and the hip inflection to 20 to 30 degrees. The doctor will graft the patient's lower leg. The clinician will then use one hand to rotate the tibia into internal rotation and the other hand to apply vulgar stress to the knee. The knee should now be flexed while holding this posture. The result in tension, instability, and eventually subluxation of the affected knee's ACL. If the tibia gets subluxated posteriorly when the knee is affected and a clunk is felt, it is a positive result that the patient ACL is torn. And the last is the Ligament test. Ligament test is conducted in a supine posture with the patient's knee flexed to around 30 degrees. With one hand, the clinician should support the distal femur while pulling the tibia toward them with the other. This is a positive test if there is an increase in anterior translation. A comparison to the unaffected side may be useful once more. For ACL rupture, the Ligament test sensitivity is at 95% and the specificity at 94%. We move to our project objective. First is to describe the clinical features of anterior cruciate ligament injuries. Second is to manage the long-term rehabilitation of patients with anterior cruciate ligament injuries. And the last is to verify that the knee braces for torn anterior cruciate ligament patients are suitable to use for the rehabilitation process. That's all from me. Thank you.
My name is AZRI and I will present for the methodology. So for methodology, this is our methodology, which is in a diagram 2D, figure 6GF in 2D. So for the forward kinematic, x equal to S2, which is L1 cos theta 1 plus L2 cos theta 2 plus theta 1 plus theta 2. Y equal Y2 equal L1 sin theta 2 plus L2 cos theta 1 plus theta 2. S2 times S0 equal to cos theta 1 plus theta 2. S2 times Y0 equal minus sin theta 1 plus theta 2. Y2 times S0 equals sin theta 1 plus theta 2, and Y2 times Y0 equal cos theta 1 plus theta 2. So X2 times X0, Y2 times X0 equal to cos theta 1 plus theta 2, negative sign theta 1 plus theta 2, S2 times Y0 and Y2 times Y0 equals sin theta 1 plus theta 2 and cos theta 1 plus theta 2. For the simulation, our group don't have a solid work because storage in their laptop is mo mostly full. So we do in 2D simulation only. So we are using Mac Analyzer to do a simulation. So this is for our simulation. This simulation is for knee braces when the knee is moved. That's all from me. Thank you.
Assalamualaikum. My name is Muhammad Haniff bin Amdan. For the expected result, non-braces produce adverse effect on the anterior cruciate ligament. Number 2 is no significant difference in the strain on the anterior cruciate ligament. Function braces are designed to facilitate normal kinematic of the tibiofemoral joint while limiting abnormal displacement and loading. Next, biomechanical investigation have demonstrated that the application of a functional knee brace to a knee that has a torn anterior cruciate ligament is effective in control of abnormal anterior. Translation of the tibia only at low anterior shear load condition and not during the high load. Next, increase the load on the anterior cruciate ligament when a brace was applied to knee, and describe this as a preloading of anterior cruciate ligament. That study suggests that bracing does not protect the anterior cruciate ligament when anterior shear load are applied across the tibiofemoral joint. And the last one is purpose of this study was to quantify the strain on the anterior cruciate ligament in the presence of normal muscular function when no loads were applied to a knee fitted with a functional knee brace, and then to determine if bracing altered. For the conclusion, this study provides a CAD modeling for simple knee braces prototype from low-cost materials such as neoprene, nylon, and aluminium to shield knee from stress and relative motion that would lead to speedy recovery and help in ameliorating the pain. The knee braces and sleeve reduce flexion and abduction movement but did not reduce the knee joint shear force, internal rotation movement, or the ACL force. That's all. Thank you.